HighBridge, a division of Recorded Books, presents Navigating Life with Chronic Pain by Robert A. Lavin, Ph.D., Sarah Clayton, Ph.D., and Lindsay Zilliox, M.D., read by Suzie Althens. Publisher's note: in this audio edition, you may hear references to figures and tables present in the print and ebook formats of the book. Part 1. Learning about your pain and how to treat it. In this section, you will learn about how your body and your mind respond to pain, and how it can affect all aspects of your life. You will discover that you are not alone, and that pain is frequently misunderstood. In this section, you will also learn how you can make the most of your medical visits and work with your doctor to develop a personalized pain plan that is best for you. You will understand how to control your pain by combining a variety of medical and behavioral therapies and physical exercise treatments that are most appropriate for you. You will also learn about the limitations of some pain medications and procedures. While it is unlikely that your pain will completely go away, this section will emphasize self-management skills that allow you to live with your pain by controlling it. Chapter 1. Understanding your pain. What is the difference between acute and chronic pain, and why does it matter? Most experts agree that there are two types of pain. Acute pain is pain that has occurred for less than 3 months, and chronic pain is pain that lasts longer than 3 months. However, aside from the amount of time that a person has been in pain, there are other important differences between acute and chronic pain. Let's discuss each separately to understand the difference. Acute pain. We have all experienced acute pain. It occurs when there is an injury, anything from a scraped knee to a broken bone. The body responds to the injury with pain, sometimes so much pain that nearby muscles will contract in intense spasms so that it is difficult to even move. This is obviously painful, but acute pain actually serves a purpose, because it teaches us to avoid painful situations in the future. It is also protective, because the pain prevents us from moving an injured body part so it has a chance to heal. After a period of time, the pain improves as the injury heals. Finally, the term acute refers to the fact that the pain resolves within 3 months after an injury or surgery. Acute has nothing to do with the severity of the pain, because both acute and chronic pain can be severe. Chronic pain. In contrast, chronic pain does not go away after 3 months, and it does not serve any useful purpose. Unlike acute pain, chronic pain continues long after the injury has healed. This book focuses on chronic pain. Chronic pain can be disabling because it interferes with common activities of daily living, ADLs, that we take for granted. ADLs include tasks like dressing, bathing, walking, getting up from a chair, and even sleeping. Because of the prolonged and exhausting experience of unrelenting pain, many people with chronic pain feel sad and hopeless. Understandably, they may become depressed, anxious, irritable, withdrawn, and even suicidal. These psychological and emotional responses to constant, unrelieved pain are what really makes chronic pain different and more complex than the acute pain that occurs when you scrape your knee. Joe fell and broke his hip at work. He had surgery to repair the injured hip and was informed that the pain he felt was part of the normal healing process and would go away with time. He used pain medication and attended physical therapy as directed by his doctor. After many months, he was still experiencing the pain, long after his doctor told him that his fracture had healed. The pain interfered with his ability to sleep, work, play with his kids, do chores around the house, and even perform simple activities like pulling up his pants, showering, and getting on and off the toilet. The constant pain had taken over his world. He was no longer the breadwinner for his family, and he was dependent on others for his most basic needs. He felt isolated and stuck in his home. He was no longer able to do things that he enjoyed, like seeing his friends, playing sports, and walking around the neighborhood. It also affected his relationship with his wife and children, because he tried to avoid people and frequently got upset over minor things that never used to bother him. Furthermore, sexual relations with his wife were impossible due to the pain. He started to feel depressed, angry, anxious, and lonely. Joe's initial pain from his hip fracture and surgery is an example of acute pain due to damage to his bone and muscles from the fracture. After his fracture had healed, the pain was no longer protective. It had developed into chronic pain that interfered with everything that Joe wanted to do and prevented him from enjoying the things that he used to do. He felt like this chronic pain was robbing him of his life. He began to suffer from emotional pain as well as physical pain. Chronic pain affected all aspects of Joe's life, causing psychological, social, and financial problems. Pain comorbidities. Morbidity means a disease or condition. It follows that a comorbidity means a medical disease or condition, like depression or muscle weakness, that occurs in the presence of another medical condition, like chronic pain. So, chronic pain frequently coexists with physical and emotional pain comorbidities, and these conditions can interact to make you feel worse. Pain comorbidities are discussed in more detail in chapters 3 and 4. You are not alone. According to the U.S. Health and Medicine Division of the National Academies of Sciences, Engineering, and Medicine, formerly the Institute of Medicine, chronic pain affects about 100 million adults and is estimated to cost up to $635 billion annually in the United States. This is more people than have diabetes, cancer, and heart disease combined. In fact, 75% of people aged 65 years and older report chronic pain. So, if you have chronic pain, then you should know that you are not alone. If you have chronic pain, one of the things that you might find most upsetting is when other people do not believe that your pain is real. If you walked into a room bleeding with a knife sticking out of your back, no one would question your pain. Most people living with chronic pain do not have such clearly visible proof of their pain. But that does not make the pain any less real or disabling. While your pain is real, it is also a subjective personal experience, which means that only you can really experience your pain. So it may be difficult for others, including family, friends, and even doctors and other healthcare providers, to truly understand your pain. Many people feel frustrated, helpless, depressed, angry, and just plain ground down by living every day with constant pain, with no end in sight. It's like walking around while dragging a heavy weight tied to your ankle. It's exhausting. However, while chronic pain may not resolve, there are ways to avoid letting it take over your life, or define who you are. Research has shown that people who feel that they have some ability to control their pain do better than people who feel that they are helpless victims to the pain. Taking control of your pain means learning more about how to self-manage it. While medications and procedures, like injections and surgeries, might seem like the obvious answers, the real answer is much more complicated. When it comes to chronic pain, usually your doctor cannot provide complete or long-term control over your pain with a drug or an injection. However, you can learn how to regain control over your pain. Learning to live with chronic pain and control it so you can get on with your life means understanding your limitations, being open to trying different treatments, and learning pain self-management skills. According to the American Chronic Pain Association, ACPA, successful treatment of chronic pain is when a person has learned how to independently self-manage his or her condition in a way that allows life to continue, maximizing participation in everyday life activities, minimizing discomfort and side effects, and avoiding other bad consequences of treatment. The ACPA goes on to state that a person should not expect to be completely free of pain, but should be able to control pain to get back on track and lead a productive, satisfying, and happy life. The rest of this chapter discusses how chronic pain develops and intensifies over time. Chapters 3 through 6 will discuss in greater detail different treatment options for pain self-management. How the brain interprets pain. It is easy to think of pain as a switch that turns on or off. But pain is much more complicated than this. Actually, your brain receives multiple signals and has to sort out what is the most important information. You are probably going to react differently if you see a lion charging at you compared to your response when you see a butterfly fluttering toward you. Your brain assigns a different importance to the lion because it represents a terrifying threat that requires immediate action. Consider this situation. While you are walking barefoot in the grass, you feel a pricking sensation on your foot. You assume that it is a small twig, because you have stepped on twigs while walking in the grass before. You probably think of the twig as a nuisance, and you continue walking. But what if you looked down and saw a puncture wound in your foot and a venomous snake crawling on the grass? Suddenly, the mild discomfort from what you thought was a twig feels much more painful because of the life-threatening importance you assign to the pain. A similar real-life story is described by Lorimer Moseley, a prominent pain researcher, in a very amusing YouTube video. The importance that your brain assigns to the pain message, whether it is a nuisance or a threat, can either minimize or amplify your painful experience. Now, fast forward to the end of the story. Several months after the snake bite, when Dr. Moseley is again walking outside barefoot and feels a sharp pricking sensation on his foot, he suddenly recoils in agony until he realizes that he stepped on a twig. The message of the story is that if you are expecting something to be a threat, then it is likely that it will hurt more because of what it represents. The importance that we assign to pain determines how we will respond to the pain, and in turn, it can either reduce the painful sensation, "It's only a twig," or amplify it, "Snake!" This story also illustrates how pain has two important parts. 1. Unpleasant, uncomfortable, harmful, or possibly harmful sensations. 2. Emotions, memories related to the pain, and interpretation of what the pain means. In other words, pain is not just about nerves sending painful signals to the brain. The importance that we assign to the pain and its immediate perceived threat depends a lot on the environment and the memory of our previous experiences. Another way that our brains modify our awareness of pain is when we are focused on other activities. There are stories of soldiers wounded during the heat of battle who were totally unaware of their injuries until afterward, when they were no longer concentrating on survival. Ironically, some of these soldiers may also faint while a nurse draws their blood when they are totally focused on a needle stick. In other words, when our attention is focused on events that are important at the moment, then we are less likely to notice painful experiences. Similar situations occur in sports events, where an athlete may not notice an injury during the heat of competition. At a recent family picnic, Jim stepped on a toothpick that went through his foot. When the toothpick was removed, he did not realize that part of it had broken off and remained buried in his foot. Several weeks later, after an intense competitive game of soccer, Jim removed his sneaker and saw that the remaining piece of the toothpick was sticking out of the top of his foot. It had worked its way through the skin during the course of the game. Jim had been totally unaware of the toothpick during the game, but his pain became unbearable when he realized that the toothpick was still stuck in his foot. The opposite version of Jim's story deals with an industrial accident during which a large bolt went through a construction worker's shoe. The worker was howling in pain and had to receive strong pain medications. When the shoe was cut off of his foot, it was discovered that the bolt had passed between his toes without even breaking the skin. These two stories illustrate the role that perception and emotion play in how we experience pain. Our perception of whether the incident represents a threat, such as loss of a foot, determines the level of emotional response. The toothpick was distressing only when Jim was aware of it, while the bolt was distressing to the construction worker only when it appeared to have punctured his foot. So, chronic pain can be intensified by our memories and how we respond to the pain. Knowing the things that can make the pain more intense can help you to learn how to control it. You may notice that your pain increases when you are thinking about past events or injuries. You may notice that emotions like anger, frustration, depression, and anxiety can increase your pain. Knowledge is power, so knowing what intensifies your pain gives you an opportunity to control your pain. This will be discussed further in chapters 3 and 5. How the brain modifies pain. To understand how your brain can change your experience of pain, think of a gate that can be opened or closed depending on the importance assigned to the pain. The more it is open, the more pain is experienced. You can also think of pain signals like water flowing faster or slower, depending on the size of the opening. There are some things that can make the pain gate open more, like expecting the worst. For example, after you stub your toe, you will probably notice severe pain initially, but you realize that it is just a minor injury and expect it to get better in a couple of days. Your response to the pain will probably not be as severe as someone who thinks that the toe must be broken and is concerned that the pain won't improve because he knows someone who developed severe, debilitating pain after a similar injury. Anxiety is likely to increase the pain. The amount that the gate is open or closed, allowing the pain signals to flow into the brain, depends on our previous experiences, emotions, and expectations. This is known as the gate control theory of pain. With training, it is possible to recognize these thoughts and emotions so that you can learn to control the pain gate. While you may not be able to completely close it, you can become empowered to control it. Here is an example of two women with very different past experiences and memories, which can affect the pain gate. A woman who has successfully delivered multiple children does not experience much discomfort during a routine gynecological pelvic examination. Another woman, who had previously been sexually abused, experiences much more discomfort during the same type of examination. The different associated memories help to explain the different reactions that the two women experience during the same procedure. Their different experiences explain their pain responses. When a person suffers a negative emotional response to pain or the memory of a painful event, the pain response may become more intense because signals are released by the nervous system in response to emotions that can cause the pain to feel more severe. In other words, a person's associated memories based on a painful event, emotions, and even the anticipation of pain can all dial up the intensity of pain or further open the pain gate. Here is an example of how you can start to close the pain gate using a simple maneuver. Have you ever bumped your elbow against a door and started to rub your elbow until it gradually started to feel better? Rubbing an injured area stimulates the nerve fibers that detect touch, vibration, and movement. These nerve fibers send an electrical signal to the spinal cord, in effect saying, "I'm okay, it's nothing serious." It's as if these more pleasant sensations reduce the pain signals, much like turning off a dimmer switch, which gradually reduces electrical current from flowing along the pain pathways to the brain. The signals from these nerve cells is thought to close a gate, like turning off a light switch, in the spinal cord, so that painful sensations are prevented from traveling up the spinal cord to the brain. So heat, cold, and rubbing the painful area all work to reduce the pain. The following medical experiment is an interesting example of how the pain gate can be controlled to reduce pain. Hospitalized patients receiving fluids through an intravenous IV line after surgery agreed to have their pain medication stopped. but they would not be told if or when this was going to happen. The pain medication was being given with the IV fluids. Patients who continued to receive the IV fluids, but were not informed that their IV pain medication was stopped, had a much longer period of pain relief than patients who were told when their pain medication was stopped. So the brain was tricked into closing the pain gate to better control the pain in the group of patients who did not realize that they were no longer receiving the pain medication. Your nervous system can get really good at increasing or decreasing your pain. If you ever practiced a musical instrument or learned to throw a ball, then you know that at first you are clumsy and have to think about every movement. But with practice and time, you get better so that you don't even need to think much about what you are doing. This is because your nervous system learns to become more efficient at performing the correct movements. The same thing occurs with chronic pain. If your pain continues for a prolonged period, then your nervous system becomes very efficient at ramping up the pain so that it is more severe and occurs more frequently. However, just as your nervous system learns to amplify the pain, you can also learn to reduce it. Will my chronic pain improve? The goal of chronic pain management is not to relieve all of your pain, because that is often not possible. It is also common that you may experience some brief increase in pain during your daily activities. The overall goals of chronic pain management are to improve the quality of your life by helping you to continue to do the things that you enjoy, to help you to stay physically active, and to be more independent. Effective pain management should provide you with the ability to self-manage your pain, realizing that there will be ups and downs, both good and bad days. Since pain medications do not completely eliminate pain, it's helpful to use other tools in our pain toolbox, including stretching, exercise, behavioral therapies, cognitive behavioral therapy, acceptance commitment therapy, meditation, hypnosis, and complementary therapies, yoga, tai chi, qigong, acupuncture, massage. Also, a good support system of family and friends will help you to better deal with pain flare-ups. This is better than withdrawing from the world around you or depending only on medications and medical procedures. Individuals who keep a positive outlook on life and focus on remaining active are more likely to adjust better to the disability caused by pain. In summary, it is important, if you have chronic pain, to stay active and engaged, to learn to accept some of the limitations caused by pain, and to understand how to modify your behaviors so you can live your life more fully. Chronic pain is a common problem, so you are not alone, and there is hope because other people with chronic pain have used the self-help tools described in this book to cope successfully with their pain. Learning how to manage your pain, adapt to situations, and recognize and figure out how to overcome your limitations are all part of the process of learning to live with chronic pain. Being resourceful will enable you to empower yourself to remain socially and physically active with family and friends. You may not be completely pain-free, but you can set reasonable goals to remain socially and physically active. Chapters 3 through 9 in this book will explain more tools in your pain toolbox to help you achieve these goals. This book will provide you with the foundation to better understand chronic pain and to communicate your pain needs to medical providers. In doing so, you can work with your doctor and therapist to develop a personal pain treatment plan that works best for you. In chapters 11 through 16, you will learn about different types of chronic pain and the array of different treatment possibilities. Chapter 2. What to expect during a doctor's appointment. Why do I need to complete all of these forms? Because everyone feels it differently, pain can be difficult to measure. There aren't any tests for pain, so doctors often rely on standardized forms to get additional information about symptoms, including pain. One common form is a pain scale that either shows different cartoon faces or simply numbers from 0 to 10. You might be asked to rate your current pain, your most severe pain, your least severe pain, or your typical pain over the last week. These scales are tools to evaluate pain, but the biggest problem with them is that they cannot be used to compare people. This is because, as mentioned in the previous chapter, two people are likely to rate pain from the same injury differently. For example, one person may rate their pain as a 2, while someone else with the same injury may rate their pain as a 6. Standardized pain scales are more useful when they are used to follow an individual patient's pain over time. It can be annoying to fill out the same form at every doctor visit, but a pain scale can be a good tool to see how your treatment is working by comparing pain scores before and after treatment. A pain score is also a helpful tool to communicate with your doctor when your pain has changed. In addition to questionnaires that are related to your pain, your doctor may ask you to fill out forms related to your general health. These are important because your doctor needs to know all about you and your history to treat you safely and properly. These additional forms are likely to contain questions about your medical history, including mental health, previous surgeries, family medical history, allergies, current medications including over-the-counter, OTC, vitamins and supplements, previous medications tried, and a history of smoking, alcohol use, and illicit drug use. Your doctor needs to know about your other medical conditions and medications to find the best pain treatment for you. Talking with your doctor about chronic pain. Tell me about your pain. Pain can be difficult to describe. It is even harder to get someone else, including your doctor, to understand what you are feeling. In general, your doctor will want to know how and when your pain started, and how it has changed over time. Your doctor will probably also want to know how severe your pain is. Often, you will be asked how bad your pain is on a scale from 0 to 10, with 0 being no pain at all, and 10 being unbearable pain, or the worst pain you can imagine. In addition to asking you about the severity of your pain, your doctor may also ask you to describe the quality of your pain. You may be asked questions such as, what does your pain feel like? Or, what kind of pain is it? The second set of questions are different because the doctor is trying to get an idea about how the pain feels to you. Examples of terms often used to describe the quality of pain include aching, stabbing, gnawing, burning, tingling, shooting, electric-like, hot, throbbing, sharp, itchy, pins and needles, or cramping. There are no right or wrong answers, so just do your best to describe how you feel. You will also be asked where your pain is. Try to be as specific as possible. Instead of saying, my back hurts, you might specify that it is your lower back on the left side, and the pain shoots down to your buttocks and the back of your leg. Kathy went to see her doctor because her leg hurt. But that wasn't enough information for her doctor to decide what was going on, because he asked her to be more specific. Kathy then explained that both of her legs hurt after she has been walking for several blocks. The pain is the same in both legs and feels tight and tingling. The pain is worst in her calves, but also involves her thighs. The pain goes away if she sits down for a minute or two. She has also noticed that if she pushes the shopping cart at the grocery store, she can walk for longer amounts of time before the pain gets too bad. After Kathy described her pain, her doctor asked how she would rate her pain on a scale of 0 to 10, and she replied that it was a 6, but it will get to be an 8 if she keeps walking. Based upon Kathy's description, her doctor was able to determine that there wasn't a problem with the muscles or joints in Kathy's leg, but there was a problem with Kathy's back that was affecting the central spinal canal. Because of Kathy's careful description of her symptoms, her doctor was able to avoid unnecessary tests and order magnetic resonance imaging, MRI, of her back sooner. He also spoke with Kathy about starting a nerve pain medication rather than an anti-inflammatory medication. Other questions that your doctor may ask include, what makes your pain better or worse? Consider things like body position, laying down, sitting, or standing, and activities.
Sample complete. Ready to continue?